Is America's healthcare system truly serving its citizens? What about workers' rights? Are they adequately protected? These are pressing questions that demand answers. In the labyrinth of American politics, two organizations stand out for their influence on different political parties: the Physicians for a National Health Program, or the PNHP, and the American Legislative Exchange Council, known as ALEC. The PNHP, a non-profit organization of medical professionals, advocates for a single-payer national health insurance system. Their influence is most evident within the Democratic Party, where they've been instrumental in pushing for state single-payer healthcare systems. The PNHP's advocacy is rooted in the belief that healthcare is a right, not a privilege. Its influence has led to increased discussions about healthcare reform within Democratic circles, with several lawmakers endorsing the idea of a single-payer system. On the other side of the spectrum, ALEC, a conservative, non-profit organization, holds sway. ALEC's influence permeates not just the Democratic Party, but also the Green Party and socialist movements in America. Tasked with drafting and sharing model state-level legislation for distribution among state governments in the United States, ALEC's impact on labor and workers' rights is considerable. Despite being labeled as a corporate bill mill, ALEC's contributions to discussions surrounding labor laws cannot be ignored. ALEC's influence has seen it butt heads with unions and workers' rights groups, often leading to contentious debates over policy directions. However, the struggle of injured workers and the lack of federal attention towards comprehensive workers' compensation reform remains a glaring issue. Workers, especially those in hazardous industries, face a daunting challenge in seeking fair compensation for workplace injuries. The lack of a unified, comprehensive federal approach to workers' compensation leaves many injured workers in a precarious situation. In summary, the PNHP's push for a single-payer healthcare system within the Democratic Party is reshaping the discourse around healthcare in America. Meanwhile, ALEC's influence across multiple political parties has led to significant debates on labor and workers' rights. Yet, amid these discussions, the plight of injured workers and the need for comprehensive workers' compensation reform remains largely overlooked. The state of healthcare and workers' rights in America is a complex landscape, with organizations like the PNHP and ALEC exerting significant influence. However, the struggle of injured workers and the need for comprehensive reforms cannot be ignored. The future of healthcare and workers' rights in America hinges on these critical issues being addressed.